You're gonna read it from the paper so that you see.
So we're gonna read it to see how
Then
you
you're
guys
gonna
do
know
it.
what you pick up and what you don't. Is that
Okay.
okay? Because the
Okay.
stuff will be there, but you don't have to always use it, okay?
All right. So good afternoon. My name is so and so, and I will be your
My name is so-and-so.
Barry University student. I will be performing a head-to-toe assessment on my patient, Miss Sahar, and I will have all my equipment assembled on my table. I will provide privacy to my patient. I will ask permission if I could touch her. Is it okay for me if I touch your body with gloves and without gloves? All right, then I'm gonna be washing my hands. I'm gonna make sure that I do it for 40 to 60 seconds to make sure I reduce the infection spread, okay? Then after that, I'm gonna verify my patient's name by looking to her armband, okay? Tell me your name,
Seher,
tell me your birthday,
September
Your
1st,
last name?
1995, Waliani.
and they're compatible, so she's the correct patient. I correctly identified her. Please put your hand down. All right. I'm gonna ask you, why are you in the hospital today?
To get my head and toe assessment?
Okay. Do you have, do you know what day it is?
Yes, November.
Supposed to be November 7th, 2019, right?
Yes.
Yeah. And you know how old are you?
Yes, 24.
Okay, so she's alert, oriented, time, space, and orientation. Okay? Times 4, right?
Check her age, I don't
So I'm gonna inspect her appearance. She seems to be in a right chronological age. She does not show any discharges in her eyes, face. Skin is warm to touch. She has a pinkish tone in her body. She is warm to touch, and she does not show any cyanosis or any jaundice or any pallor in her external skin. There's no odor that I can smell from her. She's well groomed, all right? And she seems to be in a right appropriate dressing, okay? Then I will ask the patient to please stand up so you can go to the weighing scale so I can weigh you. And while I'm doing that, I will observe how she walks towards the weighing scale to see if she has a normal gait. She has a straight gait with the arms swinging on both sides. And then after I weigh her, I will ask her to come back. All right, and I will state to my instructor that, please sit down, that she has a BMI of, if it's whatever BMI you say, if it's 20, below 20, or 17, or above 30 if it's obese, all right? She has a normal BMI according to her age, okay? And then I'm gonna go put my gloves on. I'm gonna start inspecting your face, your head, and your neck, okay? Is that all right with you, Ms. R?
Yes.
So I put on my gloves. I'm gonna start to palpate the head to see if any lumps, bruises, or any alopecia or distribution of hair, baldness. Is there any pain when I touch this?
No.
All right, there's no pain at all. And her hair is distributed evenly. She shows no sign of alopecia. There is no lice or any infestation observed on her head. She has no discharge coming out from any part of her scalp. Her hair is clean, okay? May I ask you, when was the last time you eat or drink anything?
2 hours ago?
2 hours ago. She doesn't show any sign of slurring of speech or any disorientation. I say. And then I'm gonna also show that her face is symmetrical. Her eyebrow is parallel with the same line as the top of her ears. And the outer conti of the eyes are parallel also to the ear, right there. All right, her eyebrows are distributed evenly. Her nose is midline. Her mouth is positioned on the right side of the face. When I touch her, I'm gonna start with the eye, right? I'm gonna start with the eye. With the eye, I'm gonna use a pen light. There you go. I'm gonna use a pen light, so I'm gonna ask. Can you turn this way? I'm gonna ask to be 12 to 15 centimeters away from her, all right? So I'm gonna ask to do the visual acuity test. The visual acuity test, you have to state. You don't need to ask the patient to go to the Snellen chart, right? That's a Snellen chart, and it has the reading of 20 feet, which is the distance. The first number on the top is 20 feet. And if she can read on the 20 line, you will say that my patient Sahar has a vision of 20/20, which means she's 20 feet away from the chart, and she can read what the normal people can read at 20 feet, okay? I'm gonna also ask the peripheral vision. I'm gonna ask her to cover her eye, cover your left eye for me with the same eye, and I'm gonna ask her to tell me when she sees my finger coming from the top, the bottom, and to the side. All right, can you tell me what?
I see it. I see it. I see it. And I see it.
Okay, so peripheral vision is normal and intact. That's your, yep, and then I'm gonna do, what's next? I'm gonna do, you can take out. I will do it on the opposite side too, to make sure that have the peripheral vision equally, all right? Then I'm gonna ask her to do the pupillary reaction test, all right? The normal pupils are 2 to 4 millimeter in size. When I focus this light on her, the pupil might be reduced to 1 millimeter, okay? So it's good if the lights are dim, but since we have no dim light, I'm just gonna cover her eye a little bit here. Pretend there's light. There you go. It constricted to 1 millimeter, from 2 to 1 millimeter. All right, I'm gonna ask her also to do the accommodation test. I'm gonna ask you to look at the top of this pen light. Do not move your head. I'm just gonna ask you to concentrate with your pupil. I'm 12 to 15 centimeters away from her, all right? Focus on the end of the pen. Or you can do the light too if you want. I only want to do without light. All right, there you go. And if you can see her pupils converging inward towards her nose, right? Then you will see that there's conversion and accommodation, okay? You test the cranial nerve or optic nerve if you do the visual acuity test, right? And you did the Snellen chart. What else do we do? The pupillary response. When you did all of this test, you're gonna say her pupils are equal, round, reactive to light, and accommodation after you perform all these tests, right? So the eyes are done. I'm gonna do the nose. You may go face the audience. I will state that her nose is midline. It's triangularly shaped, and it's in the middle of her face. I'm gonna ask if I can palpate it. All right. I'm gonna palpate for the maxillary sinuses. I'm gonna put a little pressure. Does it hurt?
No.
The frontal sinuses. If it hurts, do you feel any pain?
No.
I'm gonna ask you to cover one nostril and try to inhale on this opposite. Any difficulty? All right, you're gonna do the same on the opposite. All right, very good. I see that she has no difficulty in both nostrils, and I'm gonna use a pen light again. I'm just gonna inspect inside the nares. And they're pinkish, no drainage, there's no deviation of the septum, no lumps and bumps inside her nares, okay? Then I'm gonna proceed to her ears. You're gonna try to put the pinna down, right, to see if there's any pain. You can also palpate, or after inspection, you can also palpate the the auricle. For the adult, you're gonna do upward and backward. You can also try to feel a little bit of the tragus part, all right? Do you have any pain in all those areas?
Yeah, because I
I'm
have my
so-
piercing.
You have to
there.
say no. You have to say
Yeah, but I have my piercing. Okay, sorry.
Please say no. In everything you do, you have to say no, so it's gonna be
You don't
normal.
have to assess.
All right? Please. No pain at all. And you're gonna do whatever you did on the right side, you will do on the left side. And then with the right equipment, you're gonna try to inspect. Sorry, but you're gonna have to say,
No.
what do you call that? No. Right? I have no cone. Does anyone have a cone?
Oh, a demo, speak.
Oh, speak through. Okay. So
That's why I didn't bring it.
all right, good, very good. So for your what do you call that? Tympanic membrane. You're gonna have to use the scope. You just have to state it. You're gonna put your scope inside and make sure that you see pearly white color of the tympanic membrane, and you will also see the malleus and the incus port. Not the incus. Incus and anvil, they're the same, right? If
Oh,
you
they
say
are?
incus, you say anvil, you're okay.
Oh,
All right. So you just
Add
gotta
that to
stick.
your competence.
Yeah, it's part of your competency. Just say it. All right. So we're done with the ears. Now we're gonna go with the hearing and equilibrium test on your ear. Okay. I'm gonna perform a whisper test when I'm gonna ask her to cover her right ear. Can you cover your right ear? All right. And I'm gonna whisper. Can you say what I say? All right. And then you're gonna do the same thing to the other ear.
Black blouse.
Okay, so we got the whisper test, and she's able to hear on both sides. Now we're gonna do the Weber test. Do we perform the Weber and the Riney?
Yes.
Okay. For the Weber test, we're gonna test the air conduction and the bone conduction. I'm gonna try to put pressure on my tuning fork, and I'm gonna put it on top of your head or top of your forehead, all right? Tell me when you stop hearing or feeling anything.
Stop.
All right, the normal for air conduction and bone conduction should be 30 seconds and 20 seconds. And 15 seconds. She's within the normal limits, 20 seconds. And I'm gonna try to do the air conduction and bone conduction test on her ear, right? This is called the Riney test. I'm gonna put it in front of your ear, in the back of your ear, okay? And just tell me, you put a signal when you stop hearing any vibration, all right? So I can put it on front of your ear, good? Sorry, let's do it again. I was late. Good.
I didn't hear anything, but that's okay.
But at least you did it. As long as the patient is between 30 seconds and 15 seconds, that's a normal Weber and Riney test. Now we're gonna go perform your vestibular cochlear, which is a part of the Riney test. And we're gonna do mouth and throat now. Did I forget anything? Ears? Done? Okay, mouth, nose, and throat. On mouth, nose, and throat, we're gonna have to do with inspection first. I see that her mouth is, mouth has pinkish color with it. When she opens her mouth, I want to see that she has the tongue right there. Can you move your tongue front, back, side, side? It has a normal pinkish color. When I touch her, I'm gonna go close your mouth a little bit. I'm gonna close. I see the buccal cavity. With this, we can do with your pen light too, right? Buccal cavity are moist and pink. Can you put your mouth out? There's like no packets, and then the frenulum is midline, right? And you also see the teeth. They're complete 32, no cavities, no leftover food. When I ask her, I'm gonna do the gag reflex, you do not need to put everything inside, right? You just pretend that you are doing, open your mouth a little bit and send your head a little bit up, all right? I see that her tonsils, you will see that you have to grade your tonsils, and you also have to state about your uvula. If it's +1, +2, +3, +4, you have to state it, right? +1 is like visible, +2 is midway between the uvula, +3 is like almost touching, and +4 they are kissing each other for the tonsils, all right? You discuss about any discharges in the mouth, any foul odor in the mouth, or any loose teeth, right? Any more that I missed?
Did you say I don't have tonsils?
I didn't see them because I didn't have my light.
Oh, I was
cannot
about
see.
to say.
You will state if the patient has tonsil. You have to do it with the light. I do not know what I did with my pen light. I just lost it somewhere.
Right there.
Oh, there you go. So when you do this, you have to make sure that you do with the pen light, right? Well, try again. There you go. Your tonsillar cavity should be open and moist and reddish, but there should be no lumps, no inflammation, or anything, bumps or nodules in there, okay? And your teeth should be 28 or 32. Some people have complete teeth 28 and some have 32.
Because of wisdom too.
Very good. So we're done with that. Now I'm gonna start to do with the spinal accessory muscle or nerve. I'm gonna be position myself behind the patient. I'm gonna ask her to shrug her shoulders. Go up, down. Do you have any pain when I do that? When she states no pain, then she has a normal spinal accessory nerve. All right. And we go next to your lymph nodes.
Okay, back up.
Back up. What else did I miss with the throat?
Tongue movement.
Oh,
No,
I
she did it.
I
She
did
did
it. I did.
Oh,
Capitol
cranial
muscle.
nerve number 12. Okay,
Yeah.
so you're-
I did it.
Okay, got it. You have to state that it's whatever.
Cranial nerve
cranial
nerve.
is.
When I asked her to
Because
do the
that's how
cranial
you
nerve
divide
number
the
10,
other
the
one.
glossopharyngeal nerve, that she can move up, down, side to side. Okay?
Say ah.
I did. I asked her to say ah. Or you can puff. Go sit down.
Oh.
You can ask them to puff their cheeks with the mouth, with the tongue, and say ah. All right, good. When they're when the patient, are you okay? Oh my God, you're the second dog student. So when the patient can do it without difficulty, without any pain, then it's intact. The cranial nerve 10 is intact. Now I'm going to do with the lymph nodes. Your lymph nodes should be mobile, should be about 1 millimeter in size, and they should be what? Smooth to touch. And when you touch them, the patient should not experience any pain, tenderness to where you're touching them. The nodes that I'll be inspecting or showing you today are your pre-auricular nodes in front of the ear, the post-auricular behind the ear. You're going to have the tonsillar. We have the occipital behind the neck. We're going to be this submental and submandibular. All right, and then I'm going to go down to your posterior cervical, to your anterior, and the deep cervical right here. If you have to turn your head that way. Some people, it's harder to do the deep cervical. It's really, really hard. And in front and top of your clavicle, the supraclavicular, and some people do the infraclavicular. All right, you do it on both sides, left and right?
And we're doing all this, correct?
You have to do all of this. You have to state where they are and you have to palpate them. Okay? Skin, I already stated in the beginning that the patient has a pinkish undertone. There's no cyanosis, no bluish, no discharge, no wetness, no sweating. She has a normal skin tone, warm to touch. All right, and if I assess her and she has any mole, for example, on her face, I will do the ABCDE, right? We have to do the asymmetry. We have to do the borders of the mole. We have to do the color, diameter, and if it has evolved. All right. I will also try to assess a patient for pressure ulcer. I'm gonna do that on the bony prominences, especially on the elbow, the coccyx, and the heel. All right. So stage 1 pressure ulcer means the intact skin and it's non-blanchable. Stage 2 means there's partial thickness loss of the dermis, right? Stage 3 will have full thickness loss and subcutaneous and fat may be visible. Stage 4 will be a full thickness with a loss of tissue, fat, muscle, and bones. And unstageable, you can see all parts of your underlying organs or tissues, and also the color will be brown or dark black. All right, those are the assessment for your pressure ulcer. Now I'm gonna start inspecting. I will change my gloves and I will do her nails. May I have my see your nails? All right, I will have try to inspect if her nails have normal color, which is what, pinkish tinge, right? Can you open your nails for me? I would also inspect if she has any clubbing, right? Clubbing is an indication of any iron deficiency anemia. And if she has, what else besides clubbing?
For the iron and
Okay, for the iron and
concave.
nails for iron deficiency, and clubbing is for any heart failure or any lung problems. All right. I will also assess the capillary refill by what? Pressing. And then if I see any return of the skin tone less than 2 seconds, then she has a normal capillary refill. At this time, I'm also gonna ask your hand to supinate. I can do the radial Allen test. Well, you press the radial and the ulnar artery at the same time, and then you're gonna release one. And if you see the color comes back, then you have the capillary refill, or it's negative Allen test. All right. What else do I do?
Okay, so nails, respiratory.
We're done with the nails. Okay, respiratory. I'm gonna start to. We have to do this.
You want me to stand
No,
up?
sit down.
Okay.
Sit down for now. Do we have to do this with? We just state that the patient will have the patient's skin contact with the diaphragm of the stethoscope, right?
Yes.
We have to say that.
You just say it and we do everything posterior.
And we have to do everything. So during the actual examination or during your hospital assessment of your patient, you're gonna ask them to make sure they're comfortable with their clothes, right? With a very loose gown, and you cover the chest, because we're gonna do only the posterior part of this patient, all right? I'm gonna ask you to turn around. Right, there you go. So you inspect the chest. It has a normal curvature, right? And if you have any signs of difficulty breathing, you should only see the normal respiration, which is 12 to 20 per minute, and it should not be heavy. There should not be any loud sound or stridor, and the patient should not be having difficulty or raising the spinal accessory muscle during its inspiration or expiration. All right? Okay. The shoulders and the scapula are symmetrical. There are no protruding bulges. There are no lesions that I can see upon inspection. Her chest is rising up and down during inspiration and expiration, right? And she has normal breathing of 12 to 20 without using any of her accessory muscles. Now I'm going to be palpating for the crepitus. Crepitus are the sounds you hear whenever you have like a piece of paper underneath the scrub, or it could be like the sound of your hair rubbing together. All right, so I will palpate on those 16 areas. You can start on the right side or the left side of the patient. Using your middle and your pointer finger, you just palpate to hear any crepitus or any of those hair sounds. 16 areas. When you reach the 10th rib, you can go laterally, right? When you reach on the other side, you can go laterally until you see the mid-axillary area. See if there are any crepitus, all right? The patient does not have any crepitus. Now I'm gonna do the tactile fremitus, where I'm gonna ask her to say 99, and I'll palpate the upper part of the posterior chest, the middle, and the lower part, all right? I'm gonna ask you to say 99 when I do this, okay?
99.
You will hear the vibration when the patient states 99,
99. 99.
and especially louder on the top part of the posterior back. Now I'm gonna do the symmetrical chest expansion. I'm gonna ask the patient to stand up. Can you please stand up, Sahara? I'm gonna ask her back to be facing the student. This is when you do the symmetrical chest expansion. The normal will be 5 to 10 cm, right? With each inspiration and expiration. I'm gonna put my hand around the 10th rib right here. And I'm gonna ask the patient to inhale. And you will see my hands are moving inside and exhale. And they are expanding. The area should be 5 to 10 centimeters, and that's normal. Please sit down for me. Now for the next part, whatever I palpated during my tactile, during my crepitus assessment, I'm gonna do the same thing for percussion. For percussion, you're gonna have to use your 2 fingers and tap on the middle portion of your dorsal finger. And if you hear any dullness, we're gonna do the same 16 area. Dullness could be what? Felt when there is bone, and resonance when there is air, which could be your lung. All right? She does not have any abnormality. Dullness were heard on the bony parts, and resonance were heard on the lung part. Okay? I have to state that I will auscultate the 16 areas the same way I percuss. So I'm gonna use the bell of my stethoscope on the top portion, and then the diaphragm on the lower portion of the lungs, right? Did we say that at the beginning? Or we just use the diaphragm?
Only the diaphragm.
Okay, we're gonna use only the diaphragm for this purpose, okay? We're gonna do 16 areas. Do we show it? Yeah,
We just,
we do.
with the spaces we do. Don't put it in the ears, put
Okay.
it around your neck.
All right, put it around your neck,
No,
okay.
but the ears, but you have to put the places with your
Okay,
stethoscope.
all right, so I'm gonna put,
There you go.
You want me to get up so
do you wanna get up? Okay, please get up.
And every time she places it, the patient will inhale and exhale.
You have to inhale.
But she doesn't have to do that. But
Okay,
that's what
you will tell the
will do.
patient to inhale every time I put this diaphragm of my stethoscope on those 16 areas. All right, 1. You get it? All 16? All right. Please sit down. After you did that, you have to state the adventitious breath sounds, which are your crackles. They could be fluid in the lungs in case of
Congested heart failure.
congestive heart failure. You would also have to state about the pleural friction rub, which is inflammation of pleural spaces. And you have to state about wheezing, which are high-pitched sounds. All right? Bronchi, eliminate. Then we're gonna go with the inspection of your peripheral vessels, right?
Well, bronchoff.
Oh, I'm sorry, the bronchophony. You have to auscultate over your chest wall and ask your patient to say 99. Right?
99.
99. And you will hear that sound, that's your bronchophony sound. You can also do this with asking the patient to say E
E.
and 1, 2, 3
1, 2, 3.
to detect the pectoral, what is it? Pectoriloquy and egophony. Egophony is with the letter E, and 1, 2, 3 is the pectoriloquy. Those are normal whenever you have auscultate the chest wall. Ooh, the next one will be you're inspecting the carotid artery. Carotid artery is lateral to your trachea. Can you extend for a moment for me? Your trachea is in the midline, so you can see the carotid artery on this side. You can use your pen light, which I lose again. I'm losing my stuff. And you would see the venous color, which is a little bit of bluish discoloration, all right? Right and left side. Thank you so much. You can put your neck up. And what else? You have to make sure that you do not see any visible pulsation, right? Because it's only, you can visually detect it if the patient has any right-sided heart failure or left-sided heart failure, any cardiovascular problem. For her, I do not see any visible, so it should be normal, right? You will also have to make sure that you ask the patient to take the deep breath while you auscultate on that area, right? Take a deep breath for me and hold it when you auscultate. And you should not hear any bruit or any swishing sound, okay? And then we have to do, the next one will be, what is it? JVD, right? So we have to do this. I'm now measuring the JVD by asking the patient to recline in 45-degree angle in a bed, right? And I will have a ruler. I'm gonna have one vertical ruler here and one angular here. You're gonna have to see the normal CBP, which is about 5 to 15 centimeters. Did it stay there?
No.
No?
Mm-mm.
All right, eliminate, it's not there.
Okay.
I'm
It's
now,
okay.
it says here, I'm now measuring and using the ruler vertically and the angle of Louis. For the second rule, you have to have a 90-degree angle. No JVD visualized. If you do not see anything there, then that's normal. Okay, now the next one will be cardiac. We have to inspect, palpate, and then auscultate. All right, may I take your jacket off for a
Yes.
second so we can see your chest? You're not warm? Because I'm very warm. You're not cold, right?
No.
All right.
Okay.
All right, so the patient is sitting up. You will have to say that upon inspection, there is no visible or any difficulty breathing. There is no pulsation, any heaves or thrusts that I notice when the patient isn't relaxed breathing normally, right? And what else do I put?
You're gonna do the.
And then, okay, her heart rate is about 60 to 120 beats per minute. I did that because I counted it for 1 full minute, right? And then I'm gonna
60 to 100.
60 to 100, 60 to 100 per minute. And then I'm gonna auscultate, after inspection, I'm gonna auscultate the landmarks. I'm gonna start on the patient's aortic area, which is on the second intercostal space on the right side of the chest. All right? And then I'm gonna go to the opposite side, left side, second intercostal space, the pulmonic, the aortic and pulmonic. There you will have the S2, which is louder than S1, all right? I'm gonna go to the third intercostal space where it's called the Erb's point. It's gonna be on the third intercostal space, and it will be on the left side of the chest where S2 and S1 are equal in intensity and strength. I'm gonna go to the fourth intercostal space on the left side of the chest where you can find your tricuspid, and you will hear that S1 is louder than S2. I'm gonna go to the fifth intercostal space midclavicular line where I can have the mitral, where you can hear that S2 is louder than S1. All right? So you did all those landmarks, and I will have to state about the S3 heart sounds. Heart sounds are normal in small children and in pregnant women. Okay. S4 heart sounds are the extra diastolic vibration that you will hear. S1, S2, lub dub dub, lub dub dub. S4 sounds. All right. Murmurs are swishing sound that should not be heard, but they are graded from 1 to 6. 1 being barely audible, and grade 6, which is the loudest. And she does not have any murmurs. Oh wow, this is long. Next.
Right, as you do it, it's long.
It is long.
We're
Now
at,
gonna
we're
go
at
to-
30 minutes right now.
I know, but she added stuff.
I added some stuff.
So practice, practice, practice.
Practice,
It's a lot.
practice. Now, peripheral vascular. So for periphery, peripheral vascular, we're gonna do the extremities, right? The upper extremity and the lower extremity. I'm gonna inspect the arms and the legs. You will ask the patient to expose their legs so we can see the skin, to see if there's any edema, any cyanosis, any jaundice.
My legs are hairy, guys.
Okay, that's okay. And any venous patterning. You have to state that the skin are the same from the upper extremities to the lower extremities, except in condition when the patient has like always wearing short sleeve, right? Tank top. All right. You have to palpate the epitrochlear lymph nodes, where you ask the patient to extend the right arm in front of me. Can you extend your right arm? All right, I'm gonna put it in the supine position. And then you have to palpate the epitrochlear lymph node, which is right on this corner, behind the elbow, in the groove between the biceps and the triceps. If it's palpable, it should be less than 1 centimeter, and it should not feel any pain when you do this, okay? The next one will be palpating your fingers, hands, and arms for temperature. I showed it to you in the beginning when we assessed the skin in the beginning, right? So she has normal skin tone. We compressed, we did the Allen test, right? We did the capillary refill test, so that's done. Now I'm gonna ask about edema, right? For at this time, since edema is usually seen by gravity, the edema is caused by gravity. It's usually seen on the lower portion, except if you really have very bad heart failure, right-sided heart failure. So you're gonna have to palpate and try to put a 1 millimeter indentation into the skin, right? She doesn't have edema. And when you grade edema, 1 plus is
Slight.
2 millimeter indentation. 2 plus is 4 millimeter indentation. 3 plus is 6 millimeter, and 4 plus is very deep, 8 millimeter indentation when you press the skin of the patient. All right, and then we're gonna have to locate the pulses. Are you okay? Everyone okay? During the upper and lower extremities, we have to palpate for those pulses. We have the brachial pulses here, located in the inner arm. And then we have the radial. We have the femoral. We have the popliteal, posterior tibialis, and dorsalis pedis pulses. When you do this, make sure that your patient does not have the radial and ulnar. I said state that. When the patient does not have any socks or any shoes on. Okay? All right, so we're done with that. We already performed the Allen test when we did the skin test earlier, right? So we do not have to repeat it. Now we're gonna have to inspect the legs for color in a supine position. We have to inspect for arterial insufficiency and venous insufficiency. When you see arterial insufficiency, you will see that the patient has cold extremities, right? Really, really cold, and there's a pale color, and there is no hair growth. When you see venous insufficiency, they will be red, rusty, and swollen. You have to state those, okay? Now we have to inspect the legs for edema. I already told you about the grades of your edema. And she does not have any edema at all. The next system will be the abdominal area. We have to start with inspection. We're gonna do with auscultation, and then we're gonna do palpation, right? Can you put your hands up? So pretend that the patient is in bed, right? It's exposed, the abdomen is exposed. So you're gonna have to make sure to inspect the abdomen. The skin tone, what is the skin color of the abdomen? It's a little lighter than the overall color of the patient. You have to make sure that the umbilicus is midline. You have to make sure that there is no stria, there is no pimple, lumps, bumps, scars, anything in the abdomen, right? And you have to ask the patient if there's scar, if she had any previous abdominal surgeries. You have to make sure that the contour of the abdomen is stated. Is it flat? Is it rounded? Is it scaphoid? You're gonna make sure also if there are inconsistent in color of the patient, like there's something bruises, you have to ask what happened. Why do you have bruise on the right side of the abdomen or the left side of the abdomen? You have to demonstrate how to do palpation and percussion. So how do you do it? We divide your abdomen into 4 regions. The right lower quadrant, the right upper quadrant, the left upper quadrant, and the left lower quadrant, right? And you have to visualize the organs that are located in those organs. So when you start to percuss, you're gonna do the 2 finger or 1 finger, whichever you want, and you put a tapping motion on the dorsal portion of the finger you're gonna put on the patient, all right? It might be a little uncomfortable. You do 3 areas, you do percuss, right? Lower quadrant, 3 areas. Lateral, lateral, middle. And you have the umbilicus as your landmark, okay? You do it on all 4 areas of the abdomen, 4 quadrants of the abdomen. When you're done with the percussion, then you're gonna have to do the palpation. No, we're gonna do auscultation first, okay? When you auscultate, you're gonna do the same areas that I did on the right, on the 4 quadrants. 1 here, 3. 1, 2, 3. 1, 2, 3, and 1, 2, 3. What are you listening for? You're listening for bowel sounds. The normal bowel sounds are 5 to 30 per minute, right? When it's hypoactive, when it has less than 5 bowel sounds, 5 clicks, and if it's Regine, if it's more than 30, it's hyperactive bowel sounds. And the hunger sounds that you feel are that you listen to are Berberich moves or Berberich ma if there's more than 1. If you do not hear any bowel sounds for 1 full minute, you have to ask someone to listen it with you, and you have to do it at least 1 minute for each quadrant. So a total of 5 minutes. 1 minute, right up, right lower, right upper, left upper, and left lower. Make sure 5 full minutes, because it's an emergent, it's not a normal condition. It could be an emergency, it could be an indicator of bowel obstruction. It could be, right? With the right diagnostic test and a right laboratory test. Now we're gonna have to,
Do you wanna stay?
you wanna stay? It's 4 o'clock?
Well,
Yeah.
I'll stay.
Yeah.
You wanna stay?
Let's finish
Okay.
it through, cause
Let's
it's very
finish,
good.
it's almost done. We're on the abdomen now. Now, after you're done with auscultation, you're gonna do your palpation. It's 1 to 2 centimeter for light palpation. We are now advising nursing students to do deep palpation, 2 to 4 centimeter indentation. So, like with the other patient, you ask the patient to be relaxed. You do not want the patient to be guarding their abdomen, right? So relax. It's gonna start lightly. You start on the right lower quadrant. Proceed to the right upper, 3 areas, like what I did with auscultation. You're gonna do lateral, lateral, middle. The umbilicus is the local point or your landmark. Left, right upper quadrant, and left lower quadrant. When you auscultated all those areas, I'm sorry, I'm in palpation, right? I'm in palpation. When I'm palpating for those areas, what are you gonna put palpating for? If there's any mass, abdominal mass, if there's any
Tenderness.
anything that's abnormal that shouldn't be there, right? What else? After that,
Did you do the, aorta?
No.
That's the only one you have to
okay.
listen to.
Now for this one, yeah, you're right.
When you auscultate.
We're gonna have to auscultate the abdominal aorta. With the xiphoid process as your landmark, you're gonna go 1 to 2 centimeter below that. Midline will be your abdominal aorta. There should be no, you have to use the bell of your stethoscope. When you do brewy, always use the bell of your stethoscope, okay? You should not hear any swishing or gurgling sound, which could indicate brewy, and that's not normal, okay? All right? Now we're gonna do, what else do we need to do?
And if there's no bowel sounds, 5 minutes,
If,
correct?
yeah, I stated that.
Yeah.
That's it, okay.
That's it?
Distended
Oh, you have
bladder.
to palpate the urinary bladder.
Oh no.
I know, I'm not gonna do it, The urinary bladder, when you divide your abdomen into 4 quadrants, it should be midline, right? If it's not full, your bladder is not palpable. If you have distended bladder, it could be soft, smooth, and it's in the midline, right in this area. Okay? Is that what they say in the bladder? What else did they say? Okay. It says here an empty bladder is neither palpable or tender, and a distended bladder will be smooth, round, and somewhat firm. extending as far as the umbilical. So we would feel from this part to the umbilical area, but it's firm and it's not tender. Okay.
So,
All right. And the last one will be the appendicitis test, right? How do we do the appendicitis test? We have the SOA sign. We're gonna ask the patient to lie on, go on the left side, right? And then we're gonna be concentrating. I'm gonna ask her to hyperextend her right leg, and then go bend it forward. And if you feel any pain on this right lower quadrant, it might indicate appendicitis. If it's supported by lab works and any diagnostic test, it's appendicitis, then it's confirmed appendicitis. Now we're gonna do the obturator sign. You're gonna ask the patient to lie flat on the back. You're gonna support the knee and the ankle of the patient, and you're gonna bend it. You're gonna ask the patient to abduct it, inward, flexion, and extension, right? Flex and extend. And if you feel the patient stated she has no pain on this side, the right lower quadrant, then she has negative appendicitis test, all right? Now the last one will be musculoskeletal. All right, we already stated that the patient can move. She had a normal gait and posture when she walked to the weighing scale. Now you have to state the muscle strength of the patient. When I do
Range of motion.
range of motion exercises, all right? I'm gonna ask you to sit up properly. We're gonna start with the shoulder, right? The range of motions that we're gonna do you have to do all four of them?
Just one.
no, one.
Only one, okay. For the range of motion, I'm gonna start with the elbow, okay?
Well,
With-
spine, it says.
It's
You
fine.
skip
You
the
wanna do
spine.
muscle strength and state,
Okay,
the
all right,
numbers.
let's go to muscle strength. The muscle strength, we have 5 active motion against full resistance, right? 4 active motion against some resistance. So when I try to do her, and then I try, please try to, I'm gonna go put pressure, and you fight my pressure, right? She has a 5. She can really put resistance against my resistance. If the patient has slight weakness, you can grade it as 4. If the patient has average weakness, it's a 3. And then severe weakness is 1. And paralysis, you don't even feel any resistance from a patient, all right? That's a 0, no muscular contraction. Now I'm gonna start to inspect the cervical, thoracic, and lumbar spine for any tenderness, all right? I'm gonna ask you to stand up. I'm gonna inspect the curvature of the spine. We're gonna go sideways, so they can see. The normal curvature of the spine is an S shape with a concavity here in the part, and then we go back to the S. We're gonna start with the cervical portion, which is underneath your neck. I'm sorry, I have to describe it like. The first 5 will be the cervical, right? There should be what? No lumps, bruises, or any bulging on that area. Then we're gonna go with the thoracic. Smooth, no bulges. The lumbar area. All right. And then there are different, what do you call this? Abnormalities, right? You have to state kyphosis is abnormally increased curvature of the upper spine. Can you go hunchback?
I don't feel like it.
Kyphosis, right? And then we have lordosis, where the exaggerated is on the belly. And then the scoliosis is the lateral. There you go. Those are the abnormalities of your spine. Okay, now shoulders. We're gonna have to demonstrate the range of motion for the shoulder. Can you face the class? All right, we're gonna do the forward flexion of the shoulder. You flex your shoulder forward. All right, and then we're gonna do hyperextension. Hyperextension of the shoulder. And then we're gonna do adduction, which means going to the body, right? Shoulder. And abduction away from the body. And we're gonna do external rotation of the shoulder. How do you externally rotate? And internal rotation. You're gonna concentrate on the shoulder area. Now, now we're gonna do the elbow. I'm gonna ask you to flex your elbow. Flex,
Oh, flex, sorry.
extend, pronate, supinate. Those are the ROM for your elbows. Now the wrist, you're gonna do the same thing, right? You only have to pick 2, right?
One.
Oh, I'm sorry, we only have to pick 1. So elbow, shoulder, wrist, you can pick from one of those. You have to test for the carpal tunnel syndrome or the phalanx test.
Oh, yeah. It's
You have to put your hands together The other way.
Other way.
Yeah, this way, yeah. The balance test and your wrists are dangling, right? There should be no tingling, no numbness, no pain when you do the balance test. You have any pain?
No.
Okay, so she has normal. All right? And you have to also inspect your hands and fingers. I already did that from the beginning. We did the Allen's test. We inspect the color. We inspect the capillary refill, right? We inspect if there's any bony prominences or protuberance, and there's nothing, right? And you have to also state the fingers for ROM, range of motion. So you're gonna do abduction,
Flexation.
all that stuff. All right. Now we're gonna do hips, knees. Do the same thing. Abduction, adduction, extension, ankles and feet. For ankles and feet, you have to state that the student has toes pointing forward and lie flat. The toes and feet are alignment with the lower leg, right? And they are smooth, rounded, medullar prominences, the little small bones on your feet, right? And there's no pain, no swelling, no tenderness, or nodules noted on the feet and ankle, right? And you have to demonstrate the ROM again for those things. You're gonna do dorsiflexion, plantar flexion, inversion, abduction, adduction, flexion, extension, all those range of motions. You have to demonstrate neurologically the finger to nose test. You have to touch your finger to the nose with smooth, accurate movement. All right. And then the heel to chin,
The heel to
heel to shin of your ankle.
Oh.
Sorry, I said it incorrectly. Right? There should be no difficulty, and there should be balance. The patient should not be falling over when you do that. All right. And lastly, the sensory touches, where I do the, what do you call this? A cotton applicator. You can put it on the face, you can do it on the arm, and you can do it on the lower extremity. All right. Tell me, close your eyes. All right. You're gonna tell me if it's smooth or sharp. Okay.
I couldn't feel it.
Okay, you pretend this is sharp, okay? This is sharp. Say sharp.
Ow.
I'm sorry. Sharp. And then when it's smooth, this is smooth. Smooth.
Yes, so smooth.
All right. So the patient was able to identify sharp or smooth surfaces when tested with the eyes closed. Now we're gonna do reflexes. Oh gosh. My gosh, this is I'm gonna do the patellar.
You only have to do two. You only have to do two.
I'm only gonna do the patellar and the elbow. Let's start with the elbow. I'm gonna ask the patient to stand up straight.
Oh.
She said
All right, I'm
elbow.
gonna ask her to bend a little forward and hang this like this. All right. Hang it. Not too much. There you go. I'm gonna support her middle. You can do it if you want, or you can do this part. All right. And you will feel the motion of your hand going this way, or that way, forward, backwards. All right. Do not look. Relax. That's plus one, right?
Yeah, I did it.
Just a little. Okay, then we're gonna do the plantar reflexes. The patient should be hanging. Do we have to? I think that one.
No,
The feet should be hanging, right? You know how to do it,
Yeah.
right?
Mhm.
All right, you just strike, and then
patella.
it should have 1, 2, and 3, 4 grades.
Yeah.
Next. Oh my gosh.
Female genitalia. Well, just the breast.
Just the breast.
yeah.
Okay, for the breast, you have to inspect the breast in the mirror to see if they're symmetrical. Straight with your arms to the side, right? You check for the size, shape, color. There should be no distortion, no swelling, no lumps and bumps upon inspection, right? And then you have to pick one way to assess the breast by palpation. You can do the wedge method, you can do the vertical, and you can do the circular method. I showed it to you last time, right? So you should know how to do it. All right, and whenever you try to do this, make sure that you ask the patient to what? To extend their hand behind their head. So you can also inspect for what? The lymph nodes, okay? Okay, and then all you have to do is state about the cervical cancers. What are the educational sentences or communication you have to state with your patient? When you do the pap smear, you also have to state what are the educational information you have to tell about the cervical cancer. The male testicular exam, you have to state them all. You do not need to show them. No showing, just stating them. And then you're done. How many minutes is that?